Hi, my name's Lauren Wiggins and I'm Director of Services at Bowel Cancer UK. I'm delighted to introduce you to Dr Anisha Patel, NHS GP, who's joining me today to answer your questions about bowel cancer and coronavirus. Thank you for joining me, Anisha. And I think you're probably quite uniquely qualified to speak to these questions because you yourself have been a bowel cancer patient.
Yes, no, that's right. I had stage 3B rectal cancer, diagnosed September 2018. I've had 2 lots of surgery and 3 months of chemotherapy, and I finished treatment back in March 2019. And I've been back at work, gradually increasing my hours since the beginning of June last year.
Fantastic. Well, thank you so much for joining me. I'm going to get into the questions now. So the first question is, I want to speak to my GP, but I don't want to come into the surgery. What are my options?
Thanks, Lauren, and thank you for inviting me to come and speak today. Since the advent of COVID, general practice has had to evolve and change very quickly from our traditional sort of face-to-face consultations in person, which was our mainstay of consultation, to several other ways to make it accessible for patients during this time. One of the main ways that we communicate, or patients are able to communicate with us right now, is by telephone. So either telephone consultations or telephone triage. Here they can tell the GP all their problems, anything they've been measuring at home, symptom-wise, and from then on we can decide whether we can signpost them over the phone to other services or testing, whether we can give them advice, or whether we actually need to then see patients face-to-face in person, for example, if we need to do a clinical examination. We also have video consultations, and this has really increased during COVID. We have the advantage here of seeing patients actually face-to-face. And this is done by sending a secure link to patients' phones or emails, which they can just click on, and it literally opens up a screen with the doctor and the patient right next to each other. The last way at the minute that I'm also learning about, it's fairly new in our practice, is e-consults. What that involves is each practice may use a different system, but essentially the patient types in all their information, asks several questions about their symptoms. You can even attach photos. For example, if you've been keeping a diary of symptoms, you could attach that with it. That all gets pinged over to the GP, who can then see what's going on, look at any visual material that's sent, and then make a decision whether they need to ring the patient or send them for tests or need to see them again face to face. So I think we try to make it as accessible to everyone with every modality in the current climate and the restrictions that we've been working in.
That's really fascinating. So some of the things that we're doing around working from home is very similar to what patients might be experiencing, but obviously on more secure links.
Absolutely, and everything that we use is specific for the medical profession, so it is all secure links. Patient confidentiality is obviously paramount, and so it's a nationwide system that we are using for things like video consults and e-consults.
Right, very interesting, thank you. Question 2.
Okay.
I have had some symptoms, changes to my bowel habits recently. Shall I wait until the coronavirus situation has settled down before going to see my GP so that I don't increase my risk of getting infected?
Okay, so that's a really good question. My answer is absolutely not. So we don't want people to wait or delay coming to see us with any symptoms that are persistent or worrying them, that could actually be serious symptoms and a manifestation of potential cancer. GP practices, in line with government guidance and in line with social distancing as much as possible, have taken a whole array of stringent safety and precautionary things to try and keep patients and staff safe in the GP practice. So examples I can give you, often in surgeries you'll see there's one entrance and then the exit is another side of the building, so patients don't cross cover. because we are doing as we are doing less face-to-face in-person contact, we have reduced the footfall into our practice. So there are less people visiting, so reducing that risk of infection. And we are trying to send everything online, whether it be prescriptions to pharmacy or sick notes, that we don't have people coming in and out just to pick things up. Staff all have to wear PPE when seeing patients, and so it will look slightly different when you go to see your GP. They may be wearing a mask and gloves and a visor and an apron, but that is for the safety of both parties. And our staff at the front desks, you will see them in masks. Some practices have shields up, sort of just to prevent infection risk. And there'll be hand sanitising stations in the practice as well. We have actually got, in certain towns, things called hot hubs, where if I speak to someone on the phone who may possibly have suspected COVID, we don't see them in our practice. We can send them to this hot hub, so that we're trying to keep our practices clean, to see our patients that need us for all the other host of things that don't stop, like cancer. And so I think that's really important to say. With regard to cancer, you know that in COVID, we have seen less people presenting with symptoms that could be potentially serious. And it has been a worry for all of us as health professionals. And because we're seeing less people presenting with these symptoms because they're worried or they don't want to bother their GP or they feel like that, we are therefore referring less patients down the 2-week pathway, which is the cancer pathway. So if we're worried about symptoms, we have access. And these pathways are still working and have been working during COVID. So I feel that actually, you know, it's imperative that people come early, because we know that early diagnosis saves lives. And with bowel cancer, we know that if patients are worried or troubled with symptoms and present early, they are more likely and do have a better outcome and prognosis in the future. So it is vital that people come and see us, and this is my plea also, doing this with you today, is that people should come and see us.
And what are the sort of symptoms that patients might come to see you about?
So yes, so the symptoms that could present as bowel cancer include a change in bowel habit that is persistent and away from your normal bowel habit. So that may be that the stool is looser, or that you're having more difficulty going or emptying your bowel. It may include poo in the stool, in the poo, or bleeding from your rectum. It could include weight loss. It could include fatigue. And then lastly, tummy pain or a lump in your tummy. Now, one of the things that often when I speak to patients presenting with bowel symptoms is difficult is ascertaining whether symptoms have been persistent or intermittent, or how long they've been suffering, or whether they find it sometimes difficult to actually quantify. So a brilliant tool that's been released by Bowel Cancer UK in collaboration with Beth Purvis, who's a fellow bowel cancer patient, is a symptom diary card, which can be downloaded from Bowel Cancer UK's website. This is great in that it lists all those symptoms that I've just spoken to you about, and then has the days of the week for 2 or 3 weeks on it. And then over the period of time, you can actually just tick the boxes each day of what you've experienced. I think what that does for a patient is it gives clarity, and also for the GP, it provides invaluable information as to what's actually been going on. And it's obviously very empowering for the patient. So this is what my symptoms are, that I think there's a problem. And then the GP can obviously act on that appropriately if they feel it needs further investigation, management, and potentially referral. But I think it's vital that we know the story in full. And I think a diary is priceless in this.
Well, that's fantastic, Anisha. You've covered a lot of ground there. So I guess the message there is that there are measures in place to make going to see the GP when it's necessary safe, and the importance is to act on symptoms quickly. And for anyone who is watching, just a reminder of where to get access to that symptoms diary is on the Bowel Cancer UK website, which is bowelcanceruk.org.uk. And if you go to /about bowel cancer, you'll find it there. Fantastic. I'm going to go on to the third question then.
Okay.
I've been to my GP and have now been asked to go into hospital for further tests, but I'm worried about social distancing.
So this is a really good question, and actually one that I get asked multiple times a day at work, because often we have to refer patients for blood tests and they don't want to go to the hospital. But I also want to reassure you, like I hopefully have with the general practice side of things, is that also hospitals have had to take huge measures, often moving work from one department to another to ensure the safety of patients coming into the hospital. Again, in hospital, you will find that they are kitted out in PPE when they need to see you. The staff will socially distance when they can. Obviously, if they're sort of doing handling patients and they need to be there, that will be slightly different. There are hand sanitising stations all over hospitals to ensure hand hygiene, which is paramount, is adhered to, which reduces obviously any spread. And actually, COVID, when it was at its peak, and even now, is they're in separate areas of the hospital. So those patients are treated on different wards to the non-COVID patients, and sometimes there's even different entrances, again, for those with suspected COVID and those which aren't. In terms of cancer services, what they did very early on was actually, in some trusts where they could, was move the cancer work out, so that this was essentially non-COVID work, and that has allowed a lot of the cancer surgery to continue. And also some people who are being referred down this 2-week cancer pathway can have their diagnostics in this area as well. In addition to that, if patients are having procedures or tests, sometimes they are asked to self-isolate for days before the procedure to ensure they don't transmit anything during that time, and or they are tested for COVID or asked to have a chest x-ray to ensure that they have they haven't got COVID, so they can continue safely with whatever surgery or test that they need. One thing that's also there in terms of testing is the testing of the staff. So we know that there is now rapid access testing if any staff member is deemed even slightly unwell, so we get staff out quickly. But also we now have the advent of the antibody test as well, which will highlight which staff obviously have had it and haven't as well in that sense. So I think in all with hospitals, there are lots of measures in place, and I completely understand patients' perspective, but I think all the measures that can be taken have been taken.
And as you say, really important to act on symptoms, and cancer diagnosis is really important, isn't it?
Absolutely. And as I say, it's something that I feel so passionately about right now, having survived bowel cancer and had the treatment, and now seeing an obvious decrease, particularly a few weeks ago, in patients presenting with symptoms and probably worrying at home about it, saying, oh, I don't want to phone my GP, I don't want to burden them, oh, they're so busy. But actually, we still need to see you. That work continues. Cancer doesn't stop for COVID.
And that's a really important message. And I know you've just touched on the point that a lot of people are worried about going to the GP or the hospital because they feel they will be adding pressure this time.
Yeah, no, absolutely. And actually, that's the message that we have, and a lot of people have been trying to get out since all this data came out about the reduction in cancer referrals, is that actually we are trying to encourage people back in. And I know practices have been sending texts to their patient to say, you know, if you are worried, we are still open, and putting messages on our websites, just to encourage people that it's okay. And it is partly also alleviating that fear that there obviously is in the community. We have patients, for example, that have been shielding, but even when I've needed on the rare occasion to see a shielded patient, we have made provision by either seeing them at the very start of the day when there's no one else there and allowing them to come through the back door and leave, or at the end of the day. So we have been making provision to try and make sure we see, if we need to see someone, we see them.
That stay-at-home message has definitely shifted, and anyone with symptoms or any health concerns should see their GP. And the NHS is open, as you say.
It's open for business still, yes.
Well, thank you so much for your time today, Anisha. I really appreciate it, and such a useful discussion, and to get your insights, particularly, and your expertise on questions that our community have at the moment. And if you're watching this at home and would like more information and guidance about coronavirus and bowel cancer, visit the dedicated section on our website. That's bowelcanceruk.org.uk/coronavirus.